Before my placement, I thought rural nursing just meant smaller hospitals. I didn't realize it also meant making life-saving decisions with limited options and long distances. When two critical patients, one with a stroke and one with a stomach, needed transfer to Calgary at the same time, I saw firsthand how geography, teamwork, and resourcefulness shape care in Medicine Hat's rural healthcare environment. This semester, I was placed in the emergency room in Medicine Hat, Alberta. I'm originally from a town half the size of Medicine Hat, so when I came here, I thought I was coming to the big city. Once I got here and saw the community and began doing practicum placements, I saw the rural culture Medicine Hat had to offer. The community feels very strong in Medicine Hat. The people here are very friendly, and there's a sense of familiarity among locals. I've also noticed there are many community activities such as farmers markets, concerts, and other events that a lot of the town will come out for. Pictured here are when I went to the Balloon Festival and Porch Fest. Both were being put on by Medicine Hat City. Medicine Hat Regional Hospital is the primary acute care center here. Operated by Alberta Health Services, it provides comprehensive acute care, emergency, surgical, maternal, and specialized medical services to Medicine Hat and surrounding rural communities. The facility includes diagnostic imaging, mental health, and rehabilitation program. Healthcare providers in Medicine Hat have broad scopes of practice. Nurses and physicians in the ER often have to be generalists. This environment encourages strong disciplinary teamwork and continuous learning among healthcare staff. In some cases, patients must be sent to larger facilities such as Calgary or Edmonton for more specialized care. Being a rural center comes with strengths and challenges. Some strengths of being a smaller center is that it promotes teamwork, collaboration, and a supportive work environment where staff know each other well. Rural centers also offer opportunities for healthcare professionals to develop broad skill sets and take on diverse clinical responsibilities. Some challenges of being a rural center include limited access to specialized healthcare services and fewer medical professionals, which can increase workload and stress for existing staff. Patients may need to travel long distances for advanced treatments or specialized care. Also, resource constraints such as limited equipment or funding can impact the delivery of timely and comprehensive healthcare services. As I said, I'm doing my practicum in the ER at Medicine Hat Regional Hospital, so I want to take you for a quick tour and show you our resources in this rural hospital. Pictured here is one of our rooms in A pod of the ER. It is equipped with a vitals machine, ECG, IV pulse, oxygen, and suction. Higher acuity patients go to A pod, so the rooms are equipped to care for and monitor those kinds of patients. This is a B pod room. Patients in B pod are generally low acuity. This room is smaller than the rooms in A pod, and their equipment isn't as high-tech. For example, the vital monitors in A pod are connected to our computer, and they are not connected in B pod. B pod also does not have ECGs in the room. This section of the ER is run by 2 LPNs and a physician. A pod is run by 4 RNs and a physician. This is one of the crash carts we have in the ER. There are a few of these stored throughout the ER. This is used when a patient may or has gone into a potentially life-threatening cardiac rhythm that may require cardioversion. The cart is stocked with medications such as epinephrine and contains emergency airway equipment. This is the trauma room. While Medicine Hat doesn't have the resources to treat extremely critical patients, sometimes the patient is too critical to transport and must be stabilized in our ER. The trauma room is equipped with everything you need in an emergency situation, such as chest tubes, intubation equipment, massive hemorrhage kits, and many other supplies. It is also much larger than the other ER rooms, so more people can work on the patient at a time. Pictured here is one of the locked mental health rooms in the ER. We have 2 locked rooms and 1 room that is not locked in the ER for patients who come in with poor mental health. If the patient is formed, which means they have met a set of criteria that allows the hospital to hold them until the form expires, they are put in the locked room. If they are more stable, they are put in the unlocked room and wait to see psych there. This is the pediatric crash cart that is kept in the ER. We have many pediatric patients come in to emerge with coughs and colds, but the ER is equipped to deal with unstable pediatric patients, should one come in. While we do have a pediatric floor in the hospital, many of our high acuity pediatric patients are sent to Calgary for specialized care. This is some of the respiratory equipment that the hospital's respiratory therapists use. We are very lucky to have respiratory therapists at the hospital. They are specialists in respiratory care who consult on and care for patients who require Optiflow, CPAP, and BiPAP, and patients with an unstable respiratory status. Now I want to touch on a situation that I talked about at the beginning of this presentation that stood out as an experience unique to rural hospitals. One day we had a woman arrive with signs of a stroke. After imaging confirmed an ischemic stroke, the team coordinated a flight to Calgary so she could receive surgery that is not available here in Medicine Hat. Just after she left, a man with a STEMI arrived, which we also sent to the Calgary Cath Lab, but our flight crew was already gone. The physician and nurses had to work together to find a way to get the STEMI patient to Calgary as soon as possible. They had to work with Rapid and figure out the quickest route by land or wait for the flight crew. The team managed to put a plan together, and the patient was heading to Calgary by air not too long after arriving at the hospital. Before sending each patient to Calgary, the ER team worked together to stabilize the patient enough for transfer by implementing interventions that were available at our facility. They gave blood thinners to the stroke patient since it had been over 4.5 hours since the patient was last seen normal, and we gave nitro and fentanyl to the STEMI patient to try to lessen the chest pain. The team ensured both these patients were monitored closely while waiting for the air crew. Once the air crew arrived, care was passed off to their team and the patient was transferred. This situation showed me how teamwork and communication are used to meet the patient's needs in a rural setting, and how rural teams must be adaptable and calm under pressure, often working creatively to overcome challenges. This experience also highlighted the resourcefulness and critical thinking required in rural healthcare environments. With limited access to specialized services, the staff had to rely on clinical judgment, quick decision-making, and effective collaboration to ensure both patients received timely care. The situation reinforced the importance of interprofessional trust and clear communication in achieving positive patient outcomes, even when resources and personnel are stretched thin. This placement has given me a glimpse into the essential skills that nurses must develop, especially when working in rural healthcare settings. Working collaboratively as a part of a multidisciplinary team has shown me the importance of communication, mutual trust, and supporting one another to ensure the best outcomes for the patient. I think that practicing these skills will be very beneficial in my future as a nurse.